We're now live and direct. This is coming at you. This is happening in real time. We're getting the mic in place. We're very much hoping the microphone is working because there has been some issues with the technicalities in the past, but we're going to put them behind us. Corinne's here. Good evening, Corinne. Lovely to see you. Chris McDonald, Plastic Surgery, has joined, here to learn from the greats. Right, Chris, help me out if I struggle, or rather when I struggle. Got some questions. Jackie's here. Nice to see you all, which have been preordained and can hear you loud and clear. You know, it's never a problem on Instagram. It's the Facebook that's a problem. Because of the technology, because I've got the top of a range mic, I've got this bit here. I don't know if you can see this this, which is called something, which I remember when I bought it, they told me what it was called, like something like a splatter guard or so. Anyway, it's supposed to be, anyway, it's because of that Facebook doesn't work. Instagram is basically on the phone, and the phone is never lets you down. So good. So let's do some questions, shall we? And if anyone has a question that they would like to seek a resolution to, then they know what to do, don't they? Just post it here. I'll answer it. How long after having a tummy tuck with your clinic before I can move abroad? Right, before I can move abroad. Right. I would say that, well, okay, I'm going to answer the question, then I'm going to talk a little bit behind it. So the answer to the question is, I normally say kind of like 6 weeks before you can, well, not before you can get in a plane. It's probably 6 weeks before you should get in a plane, just because you're going to be a bit sore and you've got to make sure it all heals up properly and all that sort of stuff. So 6 weeks is the normal advice for going abroad, traveling abroad. Now, a couple of things to unpick here. They're saying they're going to move abroad. So the two issues I would think with that is, number one issue is that moving abroad suggests quite a big move. So you've got loads of bags and stuff like that. What is the operation? Oh God, tummy tuck. So I'd say that might be a bit soon if you're going to have a literally move abroad. I would say 6 weeks would probably not feel like moving. 3 months probably will be better if you're moving abroad. The other thing about the moving abroad, and not that I want to talk myself out of work, but if you are moving abroad soon, it might be an idea to maybe have it done abroad when you're sort of settled in the country that you're going to. So you know, if you say how long before, because I normally say to people, look, we normally follow you up and we see you sort of, you know, week, 6 weeks, 6 months, you know, just check how you're getting on and everything. And if you're abroad, that just makes a bit of an extra level of complexity with it. So that would be a little bit of an alarm bell with me as to whether you need to wait until you've had it before going abroad. But yeah, I would say moving abroad 3 months moving abroad. If you're just going on holiday abroad, 6 weeks would be my answer to that question. How do I know if I need a capsulectomy or not? Yeah, it's a really good question. I wish I kind of had a good answer to it, because when someone says I want to change my implants, we send out a price guide with changing your implants, just changing your implants, and changing your implants with a capsulectomy, and the price is significantly different. The price for having a like Raina's in the house, good to see you. The price for having a capsulectomy is significantly more than the price for not having a capsulectomy. So it is obviously something you might think, hold on a minute, what's going on here? What are they going to charge me? Basically, a capsulectomy is every single we're talking about breast implants here, for those who didn't know what we were talking about. So every single breast implant, in fact, every single implant that goes inside the body gets walled off in scar tissue, which is called a capsule, and that's normal. So every single implant has got a capsule around it. When you're changing breast implants, the question is whether you take out that capsule or not. What happens over the years is the capsule hardens and makes the implants feel hard. A lot of people think their implants have gone hard, when in fact their implants haven't gone hard. Is the capsule around the implants that's gone hard and sort of constricted around the implant. So when you're having your implants changed, you can just take your implants out and put a new implant in again. You normally need to do something to the capsule, but that might be a capsulotomy rather than a capsulectomy. So a capsulotomy is where you kind of score the capsule. You don't like remove it, you just score it to accommodate the new implant. Whereas a capsulectomy is where you remove all of the capsule. So you would remove the capsule when it was hard. If it's hard, then you would remove the capsule. And you would also remove the capsule if you're changing, like for instance, from silicone to polyurethane implants, you want to have it going into a fresh pocket. So you would remove the capsule in those circumstances. So basically, I guess the answer to the question, how would I know if I need to have a capsulectomy or not? Is your implant hard, or do your implants feel hard? Then you probably would. After a certain period of time, you'd be more inclined to. So I would say after 10 years, you'd be more inclined to do a capsulectomy. If you're not having implants replaced, then you don't need to do a capsulectomy. Some people request it because they feel that they want to have all like evidence of the implant removed, but you don't have to do a capsulectomy. You can leave the capsule there if you're having the implants removed and not replaced. So yeah, a capsulectomy does add a level of complexity, increases time, increases the risks, and so increases the costs. So it is not it's not insignificant, but it's basically if you want to get rid of all the scar tissue that's around the implant, then that's when a capsulectomy is indicated. So if the capsulectomy's gone hard, if the capsule's gone hard, then you would remove it. I'll be honest with myself, don't feel I answered that very well, but we'll move on. Happy to expand on it if the individual who was asking that wants me to expand on that, because I'm not sure if I did it justice. Jenny, guess what you got? I'm having a lipoma removal in the morning. Will I be okay to work in the afternoon? I would say no. Give yourself a day off. I don't know, where is it on your body? I mean, I suppose it doesn't matter where it is on your body. I mean, just in general terms, I think having a minor op in the morning, well, will you be able to? Probably will. Yeah, you probably will be able to go to work in the afternoon if you really wanted to. But is your work so important that you can't have a day off on your operation day? I would just have a day off. I think you probably will be able to, depending on where it is and how. But if it's like a massive one, you know, it's on my neck. I'm in at 10. Yeah, I mean, I would have a day off, Jenny. Am I doing it? If I'm doing it, I can give you a note if that's helpful, like a sick note. Actually, you do a week for yourself, can't you? A sick note. You don't need a sick note. But so yeah, I mean, I would say probably will be able to go back to work. But there's that word probably there. What if you feel a bit wobbly? What if you feel a bit, oh God, that's uncomfortable? What if it's a bit sore? You'll have a dressing on your neck somewhere, probably. And, you know, I would say that you will physically be able to, but you're better off. Yes, you're doing it. Thank you. I'll see how I'm doing it. Well, if I'm doing it, Jenny, you know, you'll be right as rain. I've got the calculation. But yeah, I would give yourself a day off if you can. If you work for yourself, then it's a lot easier because you can see how you feel. But if you work for a company or something, then it can be a bit too much to go back because they expect you all or nothing sort of thing. So I find that people who work for themselves do go back to work sooner than people who work for companies and things, because when you work for yourself, you can, if you feel you know, sore at 4 o'clock, you go home. If you don't, then you push on. But when you're with the company, you can't sort of go home, so it's better just sort of not going in, not putting yourself in that position. But you probably will be okay, Jenny. But if it was me, I would give myself a day off, I think. In fact, I know I'd give myself a day off for show. Looking forward to seeing you in the morning, Jenny. Been looking forward to this op all week. Very much looking forward to that lipoma removal. So we'll see you then. Does it help to take Arnica tablets prior to surgery? I don't know. I don't know if Chris McDonald's still on. Does he know? See you in the morning. Get an early night. Some people do. I mean, Arnica, they say it reduces bleeding. It reduces bleeding. So, not bruising. Good God, bruising. It reduces bruising. So some people say, can I take it? And I say, yeah, of course you can. It's fine. I'm not sure how much it helps. And I think one of the problems is there's often not a lot of bruising in the ops that I do. Maybe if you're having liposuction or something, there is bruising. But in a lot of the ops, there's not bruising is not a significant feature in tummy tucks and breast reductions and breast implants. Sometimes you do get bruising, but often not. So it's quite hard to know if arnica is necessary. I don't think it'll do any harm. Put it like that. I don't normally recommend my patients to take it simply because I'm not sure where the evidence is on that for these sorts of operations. But I don't think it'll harm. So let me put it like this: I don't think it'll do harm to take arnica. You're asking the question, so you've obviously heard that arnica is good. So I think it's fine to take arnica. But as I say, if you didn't ask the question, I don't tell people to take arnica because I'm not sure how effective it is. But it'd be interesting to. And you know what? A lot of this, got to be honest with you, a lot of this is people being happy in their heads. I've been thinking about this. I don't think it's the remit of this broadcast to go into, but I do think, like you kind of, the more you think about it, that your whole world is based in your head, isn't it? Everything is like the Truman Show. Everything that you perceive is in your. It's an arnica question. Is in your head. So if you believe that arnica is going to help bruising, I think it will. Now, it might be the arnica manufacturers will come and say, "Oh God, we've got this ingredient that helps bruising." Maybe it does maybe it does have an ingredient that helps bruising. Maybe people just feel like it's going to help bruising and makes them. Does it matter? If it helps bruising, fine. So if you think it's going to be a good thing, go for it. I don't think it's going to do harm. Go for it. And I think I genuinely find this in surgery. People who are positive who go in and don't focus on the negatives and things, but do tend to do better. And I think it's important to try and be positive. And if you think that arnica is going to help, all power to you. Maybe on that vein, maybe I should say, I've got this great stuff. This arnica doesn't give any bruising. It's fantastic. You got to have it. And maybe I'll get less bruising. Maybe I should, practice what I preach. So yeah, arnica. I haven't got a strong view on it, but yeah. Would having a dilated kidney affect me having breast surgery, breast implants, or breast lift with implants? Probably not. The problem with medical issues is that often usually and often, I don't really know. To be brutally frank with you, I don't know the consequences of things like a dilated kidney, and simply because is it functioning? Does it affect you in your? I'll ask questions like, the main things I want to know: does it affect you in your life? If it affects you in your life, you have to go and have dialysis every 5 minutes, and you're on lots of medication and all sorts. Then yes, that may well affect your surgery. But if you're leading a normal life and it's not affecting you, and your renal functions fine, your kidneys are working fine, I would have thought no, it wouldn't affect it. Whatever I think, what I would do is I would write to your renal physician who is looking after your kidneys and say, look, they're thinking of having this operation, breast lift or breast lift with implants. It's going to take this amount of time. It's going to be using an implant. Infections at risk. Are they, are you immunosuppressed? Are you prone to infections? Is there anything we can do to optimize your situation? Do you think she'll be suitable for an operation or not? And they might say, for goodness sake, don't have an operation unless you absolutely need it. Do not have it. Or they might say, yeah, fine, absolutely no problems. Don't have, or they might say, take antibiotics, or I don't know, they might say something. So that's the answer. We will liaise with the specialist. I'm the specialist in the breast implant bit of it. We will liaise with the renal physicians and the anaesthetist. The anaesthetist is always important in these aspects. So the anaesthetist will have a say on it. So, but I think in itself, a dilated kidney in itself wouldn't have a problem in my mind, but it can be a host of issues with a dilated kidney, from not a functioning kidney through to a normally functioning one that's just a bit dilated. So we'd have to look into that. Kelsey ABG, can I have the mummy makeover without being a mother? It may be a silly question. Do you know what? It's not a silly question, Kelsey ABG. Can I just expand on that? Kelsey ABG, you can have a mummy makeover without being a woman, right? In this day and age, we're equal, daddy do-over, is it? Well, the dad doesn't have to be a dad. So that's not a stupid question. The mummy makeover I think it's American. The Americans started it. They did a mummy with an O, mommy makeover. I do put it on my website, and I do sort of talk about it as a mummy makeover, but I don't particularly like the term. I think the term's not, and nevertheless, it seems to be in common use. But yeah, absolutely, you do not have to be a mummy, or as I say, or a woman. A mummy makeover is basically a term used for usually it's a combined abdominal and breast / chest procedure. And so commonly people who've had children have a problem with their chest and their tummy. And so it's not uncommon for mummies to have these issues. But the two things that do it are having children and weight loss. So certainly women and men who have lost significant amount of weight can have problems with their chest area and their abdomen, and so would benefit from a combined procedure. On paper, you'd call it a mummy makeover, but it would just be a tummy tuck and a breast, whatever, breast lift, or a gynecomastia correction, or implants, or whatever it is. But it's a mummy makeover is essentially a combined breast / chest and abdominal procedure, and it does by no means need to be a mother. We will not be checking your electoral register. I don't know, you check someone's a mum. Anyway, we won't be checking you're a mum. You don't have to be a mum. But it's a good question, and I didn't make the term. Someone else did. Also, do you find tummy tucks remove stretch marks? Stretch marks. They remove all of the stretch marks below your belly button, from your belly button down to your pubic area. If you've had a I was going to say you've had a cesarean, but you obviously haven't had a cesarean because you're not a mummy. So, a place where a cesarean scar is. So basically the top of your pubic hair to your belly button, all that skin gets removed. So if you've got stretch marks in your lower abdomen, yes, it will remove those stretch marks. If you've got stretch marks above the belly button, then they will remain, but they get pulled down. Yeah, and you mean stretch. So you might, if it depends where the distribution of your stretch marks are. Usually they're mostly in the lower abdomen, but sometimes they creep above the belly button. And if they are above the belly button, then they get pulled down, and often they get pulled down to below the belly button. When you have a tummy tuck, they go from above to below. But so it depends on where the stretch marks are. Do I have to have bigger implants if I need mine replacing? That is a great question. I should make a note of that, because I could do a blog post on that. Do I need to have bigger implants? That is a great question. Bigger implants. So, because I'm not a big fan of big implants. So if someone's sort of, I would say smaller implants are easy to hide, less complications, less risks, better long-lasting result, but you've got to get the size you want. So I'm never going to push someone to a bigger implant. But when you remove implants, especially if you're doing a capsulectomy, I don't know if you were here earlier, Maria, about capsulectomy things. So especially if you're removing the scar tissue around the implant, there's a bit of space there. And often over time, if you've had implants in for a while, feel might have shrunk and have a bit of extra skin. Yeah. often over time the breast skin loses its elasticity. Your breasts sort of sit lower a bit, and the breasts, dare I say, droop a bit. If you downsize your implants, you are going to have a more of a droop. So if you go to smaller implants, and in fact, even if you go to the same size implants, it might. If you I normally say to people, when you're changing implants, especially if you're having a capsulectomy, if you're changing implants, often it's good just to go up a little bit in order to get a similar result. So yeah, being 14 years. So that can be an issue. Now you might say, I don't want bigger, I want smaller. Fine, but shape might be compromised if you go smaller. So in terms of the droop, it might droop more because the implants will stretch your skin, and if you go smaller, then there'll be more of a droop. So that's when you think about, do I need a lift? If you have a lift will tighten the skin, improve the shape. Doesn't matter what you do with your implants. If whether you go smaller or bigger or same size or just have them removed completely, the lift will sort out the shape. But if you're not going to have a lift and you're only having the implants changed, then you might, if you wanted to go smaller, you might think, oh, is the shape going to be affected? Do I need a lift? Now you might say, crikey, I don't want to lift, complications, risks, scars, etc. So you could say, well, look, I'm going to go smaller because I don't want to go bigger. Fair enough. You've got to be comfortable with your own body and your own shape, and then see what it looks like. And but it will be a conversation to say it might not look as good as it looked before because you'll have that sort of skin that might droop a bit. So it's a very good question. So you don't have to go bigger, but it is kind of a little bit helpful if you do go not massively, but a touch bigger, just to take up the skin and fill the skin, because of the droop issue. And especially if you've already got a bit of extra skin now, then you might be like, well, you need a lift anyway, and then it doesn't matter what you do in terms of sizes. I'm coming to see you soon. So you did my tight up 5 years ago, and it was absolutely fab. Fantastic. Well, there you go. Well, it'll be lovely to see you again. And I'll be happy to talk to you about it in real life and to examine you and see where you are about where we're going to go in terms of sizes of implants. But yeah, no, that'd be lovely. Lovely to see you. And I hope you know there won't be a charge for the consultation because you are one of the gang, one of the team. No charge for patients of mine. So yeah, be happy to see you, and we can rap about it and work it out. Would I be able to have a breast reduction if I have been diagnosed with von Willebrand disease? So von Willebrand disease is a clotting disorder, and it's a bit like the dilated kidney, to be honest with you. The problem with blood disorders is it's always risk and benefit. And I personally would liaise with the anaesthetist and with the hematologist to see where we are, what the risks are. We have to balance the risks, basically, of bleeding and clotting. This is the problem with life as a surgeon. Not the only one, there are others, but this is one of the problems of life as a surgeon. It's like, someone gets a problem or criticizes you for something, and what you'll often find is that if you had put in measures, like really strong measures, not to get the thing that happened to them, they'd have got another problem. There's always trying to get a balance, and so basically people with clotting disorders, so it's not uncommon for people to get clotting disorders, there's a balance between clotting and bleeding because both are good, both are bad. Yeah, so clotting is bad because if your blood clots in your legs and forms a DVT, that can form a blood clot in your legs, and then that blood clot, your leg swells up, the blood clot flies off into your lungs and gives you a PE, and that's really bad. So clotting is bad. But when you have surgery, you cut all this stuff. So breast reduction, you're cutting all over the place, and it's going to bleed. So you kind of want it to clot because you don't want it to bleed everywhere, and you don't want to get a hematoma and it all balloons up and you lose blood. So, and you have to go about theatre to have it washed out. So bleeding is bad. So bleeding is bad and clotting is bad. So we need to get the balance right. So we don't want you to bleed and have a hematoma and lose blood, but we don't want you to clot and form a clot in your legs and then get a PE. So what do we do? So that's the issue with clotting. We'd have to talk to the hematologist, say, what are the risks? Are they significant? Are you on medication? Can we stop the medication? Can we do things in theatre to mitigate those risks? Is it worth taking on the risks of surgery, which will be increased? They will be increased if you've got a clotting disorder, in order to get the benefit of having the surgery. And that's something that, first of all, you need to think about yourself. But also we will talk, as I say, talk to the hematologist, talk to the anaesthetist and say, look, what do you think? What are the risks, benefits? Where's it lying? And sometimes we'll say, look, it's lying towards the not having surgery side of things because the risks are too big. And sometimes we'll say, look, no, we will offer you surgery, but you have to accept that there is a risk. And is it worth taking on that risk because you're at a higher risk than someone who hasn't got a clotting disorder? And you might say, hold on a minute, I don't want to take on that risk. They're not that bad. I'm going to live with them and that's fine. Or you might say, actually, they're awful and my life can't go on and I'm going to take on the risk. So it's like that. It's balancing the risks with the benefits, and we need help for that. Do I talking to the person, or if you see your hematologist, you can ask your hematologist, say, look, breast reduction, you're looking at a 3-hour operation, quite a lot of raw surfaces, quite a lot of bleeding, and so what are the risks with doing that? It's all a balance. That's it. I haven't got any more questions, Your Honour. Need to sort this bad boy out, don't I? Don't worry, I'm going to sort it out. But before tomorrow, the clinic, I'm going to, smart myself up. Anyone got any questions? I'm obviously a busy man, but I might have a couple of minutes. But do a bit of paperwork, maybe. Got some receipts here to go through. Council tax. God, council tax things come through. So, any more questions? No. After dinner mint. There we go. Okay, well, listen, clearly I'm very busy. So if you have any questions, post them, call me, email, Instagram me, Facebook me, or do whatever you want to get it through to me. I will deal with it next week. Are we Easter? Yeah, we're not at Easter, are we? It's a while for Easter. Anyway, so I'll be here next week. Same time, same place. Actually, I was looking at LinkedIn Live. I saw a thing on LinkedIn, but I didn't have time to see if I... Can you imagine that link? Because this is Facebook and YouTube and Instagram. Although, to be honest with you, Instagram's probably the only one that... Well, don't be rude to the others, but thanks, Jesse. Don't work too hard. Don't work too hard. No, I do work hard, Corinne. Yeah, thank you for acknowledging that. I'll try my best, Corinne. I'll try my best. I'm listening next door and I'm hearing the TV's not on, which means I've got a chance of getting in there in Antiques Road Trip, because it seems like, squatters' rights. Once you get in there first, you've got a good chance of watching your program. So I'll try and get in there. But Jackie, big up yourself. Good to see you both. Loving your die-hard support. And yeah, if you're available and it's legal and safe to do so, please join me at 7:00 next week for another enthralling episode.